Hey, are you the intern taking over care for Mr. Woodson?
Yes, I am.
Great. Are you free now for me to give you sign out?
Sure.
Okay. Mr. Woodson has been here forever. He's our 68-year-old rock with a history of COPD, OSA, non-compliant with CPAP, diabetes, and PTSD who came in for a complaint of cough, noted to have COVID pneumonia. When he came in, he was stable, but then had increasing oxygen requirements. He was transferred to the ICU, refused a non-rebreather, and ultimately required intubation. He was extubated, but his mental status waxes and wanes. We think it's delirium due to his ongoing COVID infection. Just FYI, he talks a lot, so I would stick with asking him closed-ended questions only and give updates to his family, not him, since he ends up wanting you to speak with his family anyway. And when you speak with his family, make sure you say something like, "Trust me, I'm a doctor." That gets them to stop asking more and more questions. Any questions?
How did Mr. Woodson get COVID?
Oh, I have no idea. Did I tell you about his family? They are very involved in his care. His sister calls all the time. Honestly, she just wants him home. Said that she's okay with getting home oxygen and everything set up. We should send him home with home hospice, just to get him out of here.
Is this patient a candidate for hospice?
Most of the patients we take care of have less than a 6-month prognosis. But no, this patient will probably recover from COVID. He just needs more time. Good luck.
Hello, this is Sai.
Hi, this is Debbie. I'm calling to check in on my brother, David. Are you his nurse?
You mean Mr. Woodson? Yes, I am his nurse.
How is he? Has the doctor come by already?
He's good. Still a little confused, but looks about the same as yesterday. The doctor was by this morning.
Does he have an extra blanket?
He has 2 blankets.
Okay, can you tell him I called?
Yes, I will.
What did he have for breakfast today?
He ate some eggs. I'm so sorry, Miss Debbie. I have to go. I'm needed in a patient room.
Well, okay then. Thank you. Goodbye.
Hi, this is Dr. Takimoto calling back a page for Mr. Woodson. The family has been calling frequently and would like to speak to a doctor. Did they say what they wanted to speak to me about?
Hey, doctor. Yes, the family has called multiple times to check in. We need to talk to them. We're really busy here. Yesterday, Allison had a Mr. Woodson and had to speak to them over and over again. It's too much.
I'm happy to speak to the family and help set expectations. Do you know who called?
Sister Debbie. Her number is in the chart.
Thank you. I will give her a call.
Hello.
Hi, this is Dr. Takimoto. I'm the doctor taking care of Mr. Woodson. Is this Miss Miller?
Yes, this is Debbie. Are you the new doctor taking care of my brother?
I am.
Have you seen him today? How does he look?
Yes, I have. He's still requiring oxygen to help him breathe, but is more alert than yesterday.
Okay. When you see him, you can tell him my name, Debbie. Tell him we want him to get better. He sometimes gets confused at night. I'm always the one who takes care of him. He has PTSD, so you have to be careful when you wake him up.
Thank you for letting me know that. And the next time I see him, I will make sure to tell him that I spoke with you.
Yes, thank you. And is he allowed to have coffee and tea? I always make him something warm to drink when he's sick. That helps him feel really good. He gets cold and likes to have socks on when he sleeps. Are you also able to give him an extra blanket?
Of course. I'll make sure he gets those things. He's lucky to have you looking out for him.
I am lucky to have him. I'm always the one taking care of him. We just want to see him come home. I told him to get better so that he can get out of the hospital. I know the other doctor said he might always need a little bit of oxygen. He's got COPD, you know? I told him that we could get everything set up. He's pretty weak and will need physical therapy. I have already started asking around, and we can find someone to come home to do that here too.
Debbie, since I'm the new doctor coming on, can you tell me what you discussed with the previous doctor?
I told him that we want him to come home. I want you to know that we'll take good care of him.
So what I'm hearing you say is that you want him to come home. Did you and the previous doctor ever talk about hospice? And if so, what is your understanding of what hospice is?
Hospice? I don't want to talk about hospice. The other doctor kept telling me about it. But David is a fighter. He's going to get through this. He's got his whole family here, ready and waiting to take care of him. Every day the nurses and other doctors tell me he looks good. He's breathing okay. He's not needing any more oxygen. They say he's getting better. Why are you bringing it up now? I thought you said he's looking more alert. Are you giving up on him?
I'm sorry, I didn't mean to upset you. I want to reassure you that we are not giving up on your brother. He is currently stable. There have been no changes to his clinical status over the last few days, which means that he's not getting worse, but he also isn't getting better. Does that make sense?
Yes, but we're not ready to give up. There has to be something else you can do for him. I hear on the news all the time that they're working on new things.
I hear you. I want to be very clear. We are not giving up. We're doing all that we can to treat and support your brother. The reason I ask about hospice is to clarify your wishes and make sure you are informed. You're his medical decision maker, so we do what you decide.
Okay, that's good. Good.
It is important that you're able to trust us as your brother's doctors. I'm not recommending hospice at this time. However, it is important that you know what hospice is, and it is not giving up. It's aggressively treating a patient's symptoms to allow them to be more comfortable, and it opens the option up to have patients be at home with their family during their last months of life. I would be a bad doctor if I didn't talk to my patients and their families about hospice. It is such an important treatment option that they have, but are not always aware of. And so I wanted to ask, what questions do you have about what I just told you?
No questions. I understand now, doctor. It's not giving up. And while we might talk about it later, you are not recommending it right now.
That's right. And since I'll be his new doctor, I'll be the one calling you to make sure you're updated on his care. If anything changes, I'll call you first thing. But if he's doing okay, I may not call every day. Would it be okay if I give you a call every other day?
Yes, that's fine. No need to call me tomorrow.
If I miss you, can I leave a detailed voice message at this number?
That'll be fine.
Sounds good. What else can I do for you?
I think that's it. You just make sure he has the blanket, the socks, and the tea, right?
Of course I will. Looking forward to talking to you on Wednesday.
Thank you. Goodbye.